I'm Bob McConnell. I'm a candidate for United States Congress from here in the 3rd Congressional District in Colorado. And I want to talk to you for a minute about health care and my positions on health care. And the first thing is I think this 2,800-page bill we have pending is a disaster, and we need to fight that bill doesn't get passed. The reason I know it's a disaster is I listened the other day to Catherine Sebelius, a Democrat, head of Health and Human Services, say this bill does not include federal funding for abortions. And I listened to another Democrat, Representative Stupak, the same day talk about the fact the federal bill does include federal funding for abortion. I think what the government's trying to do is play hide the ball. That's not what we need right now. We need plain talk. We need plain talk to recognize that the problem is not health care, the problem is costs of health care. We need to get the monkey off the back of the American people and make health care more affordable. I've got some ideas about how we do that. The first thing is we get lawyers out of the health care system entirely. We need tort reform in a massive way. We need to go more towards a system like workers' compensation for dealing with health-related injuries and outcomes that are adverse to a patient. Let's get lawyers out of the system. This bill doesn't take lawyers out of the system. It takes off the caps we now have in Colorado on things like compensatory damages. Let's recognize there are things we all know need to be fixed. Transportability, medical savings accounts, pre-existing conditions. We need to prevent insurance companies from ever canceling somebody's insurance after they've paid a premium when that person is sick and needs health care. We need to reduce costs by expanding the number of health care practitioners in the field. Now, I'm an EMT. I have been for 8 years. I practiced on ambulance corps in Custer County here for 5 years. I used to bring people down to Parkview and St. Mary Corwin. My wife's an EMT. She has 3 jobs in the hospital in Steamboat. Let me suggest this. We've got 13 campuses here in the 3rd Congressional District that all offer training for people at entry level in medical fields, such as EMT, paramedic, and they move all the way up to nurse care practitioner, physician's assistants. Let's encourage people who want a second career to get in the health field industry. Flood that industry with people who can provide care at a lower cost. Let's establish neighborhood health care centers. Let's staff those with people like EMTs and paramedics and nurse practitioners, all working like I did on rural ambulance under the license of a physician. So we know that when we find a patient, we treat the patient, and then we immediately get in touch with medical control, and we find out where that patient needs to go from there. Those are ways we can control the costs and get the monkey off the back of Americans who need to lower the cost of their health care. That's why I'm running for Congress. Thank you.